Hey, everybody. Good morning. It's Roxanne Davenport with Seizure of the Day and going to be talking to Pat Gibson. So let me get her on the screen here. Good morning.
Good morning.
It's nice to see you.
Good to see you, Roxanne.
I know we've talked on the phone a long time, multiple
For
times.
many years.
I know. And gosh, it was way back when you were with Wake Forest.
Yes, I'm still with Wake Forest.
Okay. And then everything you've helped teach and with oh gosh, I know medication personally because it gets so expensive, but being a professor and teaching and learning, oh gosh, everything new that's come along with studying epilepsy. um, you could probably talk about that longer than an hour.
Yeah, I have been around quite a long time.
I didn't mean it that way, but
No, I have no problem with that at all.
so what brought you into wanting to learn more about epilepsy
Well,
and
in my first job in Virginia with the state health department, I was assigned to many clinics, defective hearing, rheumatic fever, and one of the clinics I was assigned to was child neurology. And that was we had a doctor. Unbeknownst to me, he was a very well-known, nationally and internationally renowned doctor at the University of Virginia who came out into the southwestern part of Virginia that had no resources, no neurologists, and he would hold clinics every few months and bring all of his residents, and we would see something like 250 patients in 2.5 days. And then he left, and I followed those children. Of all the children that I followed in many clinics, it was the children with epilepsy who touched me most. And the thing that bothered me more than anything was the stigma that I saw that was attached to this disorder. And a little bit later, I left to go to the mental health center to direct that. And that doctor contacted me, and he had just gotten an NIH grant to set up one of the first comprehensive epilepsy programs in the country. And he wanted to do a more regional program, pulling part of Tennessee and North Carolina. And he actually asked if I would go to North Carolina and develop a program there that would be a part of this full comprehensive epilepsy program. And that's how I got into it.
that's great. How people in their heart want to teach others, and how you've helped people be able to go online
Mm-hmm.
and take the seizure first aid
Yeah.
class.
Well, the what I did when I first came here, I was actually struck, and I had worked in public health, so I had a very public health, community minded mindset, so to speak. And when I first came here, I was struck by the lack of information that
Mhm.
patients had access. Now, remember, this was in the 70s. That there was no internet. There were hardly any books in the library. There was
Mm.
no way to get information about epilepsy. And I, working with these famous doctors, had access to information a lot of times even before it was published that would be helpful to patients. So
Mhm.
I thought about it, and what I decided to do, I decided to set up an information line for the state of North Carolina so that people could call me and they wouldn't even have to give me. Remember, there was much more of a stigma attached to epilepsy then than now. And so people could call and tell me, ask me things. They wouldn't even have to give me their name if they didn't want to. And I could give them, really good up to date information, and I could talk to them as long as they wanted to talk, not 15 minutes like they get with the doctor, you know. So I one of the first things I did was to set up an information line and be have access so patients could have access to information. And then what I realized in working in the clinic, I realized that I could teach my patients and their families all about epilepsy, but if the teacher didn't know about it or the VR counselor didn't know anything about it, then they could, that was a problem. So I began going out and doing workshops all across the state. One year I did 95 workshops just for teachers. And I started getting all these calls. Teachers were actually picking up that kids were having seizures that nobody was realizing. So a big part of my thrust has always been education. I do tremendous amount of education of every group. And for years I've done over 1,000 workshops in North Carolina across the state. Then I began reaching out further and I do national conferences for doctors and nurses. And I do a national conference for pediatric neurologists and the nurses, the nurse practitioners. So I'm constantly doing education in addition to answering, questions on the line. And when I set up the epilepsy information service, one of the things that I did with that line, and it was interesting that early on in the first year, and this was only for North Carolina, but one day my telephones were having a problem and they came and worked on my 800 number. And I don't know what happened, but they opened me up to the whole nation.
Yeah.
I've been nationwide since 1979. So but what I did in North Carolina is that I documented the needs and concerns of patients. And when I would see these big needs, I would try to advocate to do something about it or to try to get someone else to do something about it. And one of the first things that I documented in North Carolina, one of the biggest needs we had with that, there were a lot of people going without medicine because they couldn't afford it. And this was in the days when it was a lot cheaper than now.
I was gonna say still that way.
So
Mhm.
after my first 10,000 calls, I documented that the number one need in North Carolina, we needed assistance with medicine. So
Mhm.
I reached out and started to get someone to do something about it. To no avail. I couldn't get anyone interested in doing anything. So I finally just set it up myself. I got a bill and I set up a medication fund for the state. And unfortunately, in 2009, it was we lost all our funding from the state because the economy fell apart. Sort of like right now, there were very unsteady times, and so I began fundraising. And at that time, what had happened is our epilepsy foundation of North Carolina fell apart, and they were getting
Yeah.
ready to close. This was about 15 years ago, and their board came to me and asked my help and said, "Would you help us and would you take over?" And I did at no pay. So I became director of, we're now the Epilepsy Alliance North Carolina, because the foundation decided they wanted to go on a different mission and not do direct patient services. And we're very much about direct patient services, as you know. We
Yeah.
need to provide what you need, and all of our money goes absolutely to 100% of our money goes to patient services. And so with our medication fund top of the list, I, as long as I am here, I will not let anyone in this state go without medicine. I
That's wonderful.
absolutely am committed. I don't have to tell you how important that is. I
No,
mean, you can die if you can't get your medicine. And so that has to be our top priority. And,
people don't know that. And then too, you talked about helping with explaining epilepsy
oh, yeah.
in the 70s.
Mhm.
Well, still, some people don't
Oh,
understand it now.
I was on the phone late last night with a young man from Pennsylvania who said that he didn't understand and he didn't know and he had lots of questions, but he wasn't getting this from his doctor. So I talked to him for an hour and a half
Wow.
and went into every detail and explained about his medicine and gave him the tips on things that could be helpful to his seizures and it was wonderful. I mean, and he was just really grateful to have all of that information. And
Yeah,
there's a
and
lot of, I especially want patients to know things that can trigger their seizures that they may be doing to make their seizures worse and may not have this information, may not realize what they're doing is actually causing their seizures. So
Right.
I spend a lot of time talking about that. But the wonderful thing is being able to work through the alliance and advocate for things. We watch everything. We speak out about it and go after it and try to make changes. And we've been able to expand our services a little and help people get to their doctors or help in different ways. And if I could get enough fundraising done, but we fundraise every waking moment, and it takes a lot of time and energy to do that, to keep everything going. But it's so important. It's We actually have a big gala coming up in Raleigh in June. We're going to be doing a basketball camp in June too, with the former coach, coach of the New York Yankees, who flies out of Alaska to be with us to do this camp for children, and it's an incredible camp. And we do our big chili cook-off every year. I think you've
Mhm.
been to that and helped us with that. We have raffles going. You can win all kinds of things. And we have a art for the cure. We have a big cornhole event this year in Charlotte. We have a major walk in Wilmington. We're just doing constant fundraisers and just so appreciate the support we're getting from people across the state, because every penny of this goes to help someone in some way.
Yeah,
Um,
you just volunteer.
yeah,
In your heart. I mean, it just amazes me that all the people that just volunteer. I just say thank you so
yeah.
much.
Hmm.
All you do, and you have only one other person
Yeah,
helping you right now, right?
we've lost most of our funding, and so I hope to get that back from the legislature, but it's a very crazy time at this time, so we don't know. But oh yeah, and we also are starting. We'll be giving out 5 scholarships this year for students with epilepsy, and I'm also on the board of the Epilepsy Alliance America, and we give out. We're the only group I know in the country, maybe even the world, that actually gives out scholarships for students with functional neurological disorder or psychogenic seizures. That's a big, big problem that we deal with in neurology. That many of the seizures may be emotionally based or psychologically based, and those people get very little help, and so we're interested in that group as well.
Yeah, that's wonderful to be able to help children have as normal a life as they can, just because of the medications helping too.
I know. And the research is so exciting right now. I've been around a long time, and I started when we had only about two medicines involving Darlington, and that was about it. And if you didn't respond to those, well, too bad. And then we kept getting more, and now it is really exciting what choices we have of medicine. And some of our newer medicines have made all the difference in the world for patients. And we're coming, and actually we have a clinical trial right now. We're looking for patients that have like 4 focal seizures a month, and we've got a new exciting medicine that we're doing clinical trials on that may turn out to be an amazing medicine. So research is so important to keep us improving things. And we've got new surgeries, we've got all kinds of new, and the genetic things that are happening are
Mhm.
amazing. We're now finding genetic causes of seizures that we had no idea about. And once you know the underlying cause, then you know how to go after that. And I predict in the future you're going to be able to see genetic therapies that will totally change those problems.
That's
And,
amazing. Yeah.
and like right now, we have a surgeon in this state that is actually doing a clinical trial inserting stem cells into lesions in the brain to
Oh,
grow new brain cells. Now, how amazing is that?
that
It's
is
mind blowing.
wonderful.
Hmm.
Wonderful.
Yeah,
Yes. Because while I did ultrasound and worked in the medical field, I knew about stem cells,
Hmm.
working with a reproductive endocrinologist.
Hmm. Yeah, there's just a lot of exciting things that are happening, and it's so sad when I see, so much money being spent on war all over the world. When if we took that money, quit fighting everybody, and put that into research, what an incredible world we could make. I mean, just it's amazing what could be done with the right research, the right, you know, new technologies. I was actually privy when we first started. They started doing blood levels. There was a time we had no blood levels. We didn't know how much medicine was in your bloodstream. And then Dr. Kiffin Penry at NIH at the time actually promoted the development of blood levels, and nobody had them. So I got some money from the legislature and helped fund the first one at UNC at Chapel Hill. And because of that, the director of that lab, he would, for any kid out there that couldn't afford a blood level, if my name was on it, he would do them free. So
That's
we were
great.
able to get blood levels on kids across the state that needed it free for those that couldn't afford it. And I'll have to tell you, Roxanne, one time on my information line, I got a call from Atlanta, Georgia, and they had a porpoise there that was in SeaWorld, and the porpoise had started having seizures, and they put the porpoise on medicine, but it didn't work. They didn't know what to do, and they called me to see if I had any ideas. And I said, well, first of all, you need a blood level. You need to know whether or not you've got enough medicine in that bloodstream for that porpoise. And they said, well, how do we do that? I said, you send me the blood and I'll get your level. And I actually sent it to the UNC lab, and I filled out the lab slip. His name was Dolly. I wrote Dolly, porpoise, occupation, performer. I mean, and sent it in. And the director was just about shot me when he found out this was actually a porpoise. But we try to help everybody, even the animals. I do get a lot of animal calls because
Oh, wonderful.
dogs and cats can
Mhm.
also have seizures too, and they're on the same medicines that we are.
Yeah, talk to people about their dogs,
Hmm.
and I have to brag on mine because he wasn't trained, but he knows when I'm going to have one.
Oh yeah, they train themselves. Hmm.
Hmm. Yeah, and that you talked about the medication, and oh gosh, how many I have been on working with mine,
Hmm.
and all the side effects too.
Hmm.
And this time figured out one of them made my vitamin D level so low. That's why I was falling asleep during the
Hmm.
day. Just even, well, sounds awful, but I would drop my fork while I was eating.
Hmm.
That's how low my vitamin D was.
Hmm.
And doing a level, one of the medications was causing it.
Hmm.
So, even though the medicine was helping, they added a vitamin D like
Hmm.
50,000 milligrams once a week.
Oh, that doesn't sound right.
Well, it was 10.
Hmm.
That's how low my D was.
Hmm.
But I only did that one for a month
Yeah.
to bring it up. And now I
Hmm.
just take an extra D,
Yeah.
my
Almost
vitamin.
everybody is recommended to take D3 because we so
Mhm.
many people today are not getting out. They are on the computer all day long. They're not getting any sunshine, and they're not getting out it much. So a lot of people are deficient in vitamin D3. But
Yeah.
you want to be really careful in taking any kind of supplement, and be sure to work with your doctor on that because some of the supplements can interact with your seizure medicine And you may not know that this is not a good supplement to be on. Just taking this, things that you get off the internet and things like that. Want to be really careful about that.
Right, right. Because I did that
Yeah.
to know what extra minerals to take and
Uh,
how it would help and how it
yeah,
would.
you always check with your doctors about these things because I've had people take things that were actually causing major problems for them, and they didn't weren't
Mhm.
aware that it was the supplement that was doing that. And
Do you remember Karen Oles?
oh, she was wonderful.
I
Yes,
know.
pharmacologist. She was a major asset to our program. She
Yeah.
followed many patients and worked so hard to get them on just the right things.
Uh huh.
And it really, really was a most admirable person.
Definitely.
Hmm.
Definitely. And Dr. Bell,
Yes.
when she would work with him.
Hmm.
And so funny, all the residents that go through there,
Hmm.
as many times as I would go and they would come in first, I
Yeah.
would quiz them.
Uh-huh. You were helping teach them as well. Yeah.
Yeah, that's funny, but you had to teach them too.
Yes, we not only that, I participate in, we have an epilepsy mini fellowship at Grayland that we do, the Kip and Penry mini fellowship, and we've trained over 10,000 doctors on epilepsy, and we pull in third year residents to that program and fellows in that program. We do constant education about epilepsy here at this center. And I'm working with them. And an exciting thing that I'm finding just this past year, I've had a number of young people come to me to help mentor them. And many of them are going to be going into medicine.
Wonderful,
Hmm.
wonderful.
Yeah. And I'm trying my best to influence them and guide them into the field of epilepsy.
And I
Because
appreciate all.
I don't know if you're aware of this, we have a major shortage of, especially pediatric neurologists. We have a major shortage of neurologists, but especially pediatric neurologists. And many people are having to wait many months to be seen, and that's just not acceptable. And but it's a major problem all over. There's such a shortage.
Wow, I didn't know that it was that bad.
Yes, it is the very bad.
Um, yeah, and then also informing the schools, the
Hmm.
teachers, letting them know what
I
to
did
do.
a I did a 20-year project in Forsyth County years ago after an experience in a school where it was obvious that the principal didn't have very good information and the attitude and everything I was concerned about. So I walked away that day from that talk and I thought to myself,
Yeah.
what if you went into a school and you taught every single child of a certain age about epilepsy in a positive way. And I made up this project to teach, and I decided to focus on fourth graders because third and fourth graders are the most curious, the most open, and the kindest of ages. They're I did not know it, but I was later talking about this on public radio, and I had a psychiatrist call in, and he said, "You do know that 8 and 9 years is the key years that children are forming their world attitude, their worldview, and that's the
Wow.
most crucial time to reach them to make change." I didn't know that. I just knew of all the ages because I had always gone into anytime I heard about a child having problems at school, I would offer my services. I would go there. I would teach all the children. I would teach the teachers. And I found that age group to be the best in terms of being the most receptive. So I made up a project that I would teach every single fourth grader in Forsyth County,
Mm,
class by class, because if
wow.
you lump them together, they get too excited and they don't pay attention. So for 20 years, I went into the Forsyth County schools and taught every single fourth grader. And I saw many, many things happen. In fact, there was one child who, after that class, went running to his grandmother who taught first grade. And he said, Grandma, Grandma, I this woman came in our class today and she taught us all about seizures, and now I know that those little things that I have, I'm having seizures. And she said, No, no, honey, that what you have, that's not seizures. You just have those little spells. And he said, No, and he got very upset. He says, I'm having focal seizures, even because I teach them the terminology.
Uh-huh.
And I taught them, the terminology. I taught them the different symptoms, what you should do for first aid. Every single one of them would tell you all the steps of first aid. And I talked about feelings and attitudes and tried to instill a very positive attitude of wanting to help kids with epilepsy. And so, uh, to my utter amazement, he kept on being so insistent that she took him to his pediatrician. And I'm sure she rolled her eyes when she said this. Just some woman came into his class and taught him about epilepsy, and now he thinks he has it. And the doctor said, Well, I'll tell you what, we'll just order an EEG. And
Yeah.
guess what? He had focal seizures and went to surgery when he was 12.
Amazing.
Yeah. So I did, by doing that class, pick up a number of kids that were actually having seizures that no one had recognized in teaching the teachers and teaching the students.
Yeah, that
Mhm.
needs to continue
Mhm.
because you think they're staring off into space, but it could be like a partial complex, like
Mhm.
I
It
have.
could, yeah, it could be, or it could be staring off in space. So you have to know, but you have
Yeah.
to be aware of the possibilities and things and look at them a little bit differently.
Yeah.
Hmm.
And say thank you to you and um, trying to keep up with all you've done and what is going on to put on my website. I got this long list from an email. Thank you. Thank
Um,
you.
it's been a wonderful journey, and it gives me the greatest of pleasure to uh, to be able to help people in whatever way, in their journey with epilepsy. It's they're just, and there's a lot of hope out there now for what's coming down, and I want people to know about it, and I want to do everything in my power to see that people have access to the very best care, and the very and not only that, to feel good in themselves that this is just another medical problem, and we all have medical problems. If you live long enough, I promise you it's going to be one thing or another. A few people get born and die right away and don't have a problem, but the rest of us, we all will be facing a problem of some sort, in a medical problem of some sort in our lives, and we all just need to help each other every bit we can.
Yeah. And well, I know we're running over time and you've probably got a lot to do.
Thank you, Roxanne, for sharing all these things with people and for what you're trying to do for epilepsy.
Oh, no, thank you for how long you've been, working with people and the doctors.
Yes. Yeah.
So, um, uh, just if there's, I'll put down the email and the phone number.
Just give our number should anybody, need that information. We're here to help in any way.
And it's the Epilepsy Alliance
Or
webpage.
the Epilepsy Information Service. Those phones come in, the same thing.
Okay. Well, thank you again,
Okay.
and
It's good
I'll
talking to you.
I know I'll be talking to you again.
Okay, Roxanne. You take care.
You too, and I'll just let you go and say
Okay.
bye.
Goodbye.
I
You,
appreciate it,
a
and
pleasure. You take care.
you too. everybody. It was wonderful talking to Pat Gibson with the Epilepsy Alliance and where she had worked with the Epilepsy Foundation and working when there was only two medications. That's how long she's been doing this. So I will put down on YouTube the numbers you can call if you have questions. And I appreciate everybody that's come to watch today. And I want to say thank you again. And probably it'll be a couple of weeks. And I'll put information out again for y'all to come and see. And thank you, everyone who's come. I noticed a lot of people that had wrote some messages. I appreciate that, y'all. And we'll call it a day. Bye-bye.